Hello, everyone. Welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors. And here on The Social Doctor, we are on a mission to help doctors in taking the right decisions for their career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Rajesh Verma with us. He is the director and a senior consultant orthopedic surgeon in Narayana, Gurgaon. With more than 23 years of experience, he has cracked the code of establishing himself in the metro in Delhi NCR. And so he's here to help us understand his principles that he has followed in his journey. How did he evolve himself so that he could make his space in Delhi NCR and done so well for himself. Welcome, Doctor, to the platform. It's really nice to have you here.
Thanks a lot. Thanks a lot, Dr. Ayushi. And thank you, Social Doctor, for inviting me for this wonderful cause. I think this is going to be a great help to the young professionals who are thinking of achieving something in medical practice. Although doctor profession itself is a great platform to help others and earn good income, but establishing in metros is a big challenge. Everyone has a wish to settle down in big cities, but there are certain challenges which we are going to discuss. And thanks again for inviting me here. And welcome everyone. And be free to ask any questions you have. You can put in the comments. We can discuss it right now. And if there is some shortage of time, I'll be more than happy to discuss it later. And I'll be more than happy to guide you, help you, mentor you. If there are certain questions, I'll be happy to answer later also. Thank you very much.
Yes. Thank you so much. Actually, we are glad to have you here. So let's start with discussing your journey in brief. How did you start, and how did you come to the conclusion of settling here, and how did it go further?
Yeah, I strongly believe that you should have a definite plan before embarking on any journey. Like I completed my post graduation in 1997 from Medical College Rohtak, and I did my graduation also from there. Then at that junction, I had a plan that I am not going to open my own hospital or a clinic because I didn't like that kind of practice. Also, I'm not getting biased or I'm not getting critical about that. That's a great help. People are opening small hospitals, clinics in tier 2 town, 3 town, and they are doing tremendously well for the society. But I personally didn't want to go into that because that puts you into lots of responsibility. So that day one, I was extremely clear that I am not going to open my own hospital. So that gave me one direction that there are only few options left. Either you work as a freelancer or you join some corporate setup or you join into a medical college. So I was selected as an assistant professor, but somehow I couldn't uh, continue into that. And then I decided to settle down in Gurgaon. At that time, 20 years ago, there was nothing big about Gurgaon, although it was a sub city of Delhi NCR, but it was not that big as it is now. So I will say I was lucky that we settled in time in Gurgaon, and like slowly we grew from here.
Mm-hmm. No, that's nice to know, and actually the early you take a decision and the early you are clear what you want to do helps you to settle down, in a better way. So now when you tell us that you were very clear and how did you do so, what were the basic principles that you followed since the start of your journey, that helped you to get established?
Yeah, one was to like in this era of information, if you are ignorant, it is by choice. Like I was very clear that I have to self educate myself. I have to learn new techniques because learning never stops, especially in medical practice. Like I was jack of all trades and master of none at that time. Like I was doing all the trauma work because at that time in Gurgaon there were no big hospitals, there were no corporate hospitals which would allow you to perform high-end surgeries like knee replacement, spine surgeries. These things came up later. But at that time in 2000, I was like doing everything. I was good at trauma, I was good at arthroscopy, I was good at joint replacements, also very less in number. But few spine surgeries were being done at that time. So there was no choice then to become a freelancer. So I joined almost 20 hospitals in Gurgaon. There were
Okay.
only few doctors who were doing that. And the life was quite hectic. I had to put lots of work. Like you won't believe, at that time we used to have small Nokia phone or
Yes,
Samsung
yes,
phone. I used to lie down, keeping the phone on my ear. Even at
yes.
2 a.m., some call will come. I will just wake up and drive and go,
Mm,
whether it's a fractured clavicle or whether it's a hip dislocation. I will never say no. So first principle was to do lots of work at that time. I was young, I was dynamic, and I was willing to learn. So I
mm,
never said no to anyone. And
mm,
second principle, the trick of the trade is never ask for money. You know,
mm,
it looks surprising, but never ask for money. In
mm,
freelancing, you have to give your best and take it as an opportunity to learn and to perform more and more numbers. The more you work, more patient bank becomes of yours, and they will come to you if they have got good results. Whether you treat a patient from a nearby village or whether you treat your international patient, word of mouth publicity is the best. More better results you give to your patients, more patients will come back to you. So I never said no to anyone, never asked for money. Whatever they gave, I just took it and thought it's a gratitude, it's a God's blessing that I am at least learning, I am doing more and more number of patients. So I think you should never ask for money in freelancing. I'm not saying that you should leave money, but there are certain stages of life. In early stages, you should focus on learning and doing lots of good work you can do.
mm, mm,
As new hospitals came up, I was like also fed up of doing freelancing for 10 years. I did that. That
mm,
gave me a great platform. That gave me a good amount of number of patients. I had a great patient bank. And
mm,
that's why I got into the corporate setup. And there the things are totally different. You don't do all the trauma work. You have good people under you. You have a great team to work with.
mm,
And I will again say that whenever possible, you should make a good team because teamwork gives lots of freedom to you, lots of opportunities to focus on one thing. As I said earlier, that whether you want to become a jack of all trades or master of one.
mm,
So I met one of our senior colleagues who was director of one hospital. I am not going to name him.
mm,
He called me, Dr. Verma, you are a fantastic surgeon, you're a fantastic
mm,
human being.
mm,
But how should I recognize you? Are you a joint replacement surgeon? Are you a sports injury specialist? You are a trauma surgeon? Like, I'm not sure what you are best at. So,
mm,
my advice, he gave me a fantastic advice, which I would like to propagate to my colleagues and my younger friends
mm,
that you should learn everything, but at least one department, one focus area should be there by which people recognize you and you should be famous into that. So you should choose one field. Like there are not too many fields in orthopedics, like joint replacement is quite saturated. Then sports
mm,
injury, arthroscopy field is also saturated.
mm,
Spine surgery is there's always a tussle between neurosurgeons and orthopedic surgeons. So
definitely.
it
Yes.
was a difficult choice for me because
Mm,
I was working in a team and my colleague, my classmate, Dr. Oberoi, he's fantastic arthroscopy surgeon and a joint replacement surgeon. So we were
mm,
in a team for 15 years. So he
okay.
was the one to nudge me, to push me towards spine. And
Mm,
that was a fantastic advice and fantastic nudge by my colleague that
mm,
I came into the spine surgery field. At
mm,
that time, 10 years ago, 12 years ago, spine surgery was not that
great.
commonly done because it requires very good setups.
Mm,
You need very good lighting system, C-arms, and all those things are not
mm,
available in smaller hospitals.
mm,
So
mm,
at that time, I came into spine surgery and I started building up into that field. I attended only spine surgery meetings. I spoke only about spine surgery. Although still I do other things, but I focus my area as a spine surgery. So you
mm,
should like limit yourself to one or two things and
mm,
try to build up from there.
mm, 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 mm. Definitely. So this is a very important point that sir has mentioned, that especially when it comes to settling down in a metro city, it's very important to build your niche, to build your specialization, so that people remember you by that and come to you for it. And that is what leads to building up your practice and bringing fame by to your name. So,
Yeah.
and this is something that actually he has also done. He's a one of the best spine surgeon in the country, and so he's known by that. And as well as two more important points that he mentioned, that the early years you need to work on learning and growing, which is something I believe, after passing out, all of us doctors at times just miss this point, because then we are already learning for so long that we tend to fall in the trap of just thinking of earning. But this is something that we need to actually keep in our mind, of learning at least in our initial years, and not to fall in the trap of asking for too much of money. So these are actually really nice points that you have mentioned. So one more thing, nowadays there is a lot of craze of fellowships, after, especially when it comes to settling down in metros, how important it is. And what will you suggest, for people who are planning to going for multiple fellowships, and doing multiple specializations? What is your suggestion for that?
I think fellowships are a great platform to like progress in your life. Like as I mentioned, I passed out from Medical College Rohtak. At that time, we were only doing basic surgeries. Like we were never exposed to big joint replacements, revisions. Spine surgery was like into its primitive form. Only laminectomies were being done, and similarly, arthroscopy, sports injuries were not being done. So frankly, if I say what I am doing today, I learned nothing from there. But the basic platform, the principles never change. So my advice would be to like make yourself strong in basic things like general surgeries, trauma surgeries, approaches, all approaches you should know. You should must work in a high practice hospitals, government setups for initial 1 to 3 years. Like I did 3 years of senior residency from Rohtak, then I came to Delhi. I did 1 year residency, senior residency in RML Hospital and Lady Harding. Like these are bulk hospital where you get plenty of trauma, plenty of surgeries you can do independently. Once you become confident about that, then you have to choose a subject and then go for a fellowship. Many people, what they do, they straight for after post graduation, they go for fellowship. And you won't believe fellowships also differ a lot. Like I did fellowships from USA, nothing they will teach you. Only you have to become a observer. Although that is also important, but unless you get a hands-on feeling, it is difficult. Like I did fellowship from Korea, that's a wonderful place to visit, and they allow you to scrub in the day one. So it depends from where you do fellowships and for how long you do fellowship. So fellowships are important, but basic thing is to become conversant and become confident on basic surgeries like trauma surgeries and basic joint replacement and all those
Correctly said. Now, when you mentioned that you have also done fellowships from international places,
things.
I know there are so really good places in India as well. But how has what do what do you feel when you did it from internationally? How was it different from the Indian setups? How did it help you?
So I have a strong belief right now also that I should visit every 3 to 4 years to an international setup to learn new things and what they are doing.
Hmm.
Like in our time, the information was not being passed so fast. Nowadays, whatever is happening in Korea, USA, Germany, it comes to India within a year, less than that. But in our times, it used to take 3 to 5 years to come to this place. So whenever you go to those places, you learn new things. You see the arrangements of the theaters. You see new machinery, robotics, navigation. So it's an eye opener for us. So I would suggest everyone, if they are working at tier 2 or 3 cities, they must come to tier 1 cities like Gurgaon, Delhi, Bombay. So we have international setups in India right now. But
Yes.
still, I try to visit every few years to some good places for a observership, for just visitation. So it gives you new perspectives and it opens up for new ideas. And for other cities, I would say if they are not able to go to international, our Indian hospitals right now are as good as they are in international places. So
Yes.
it's very important to visit international places or good hospitals.
Hmm. Correctly said. I also agree. It helps you to broaden your horizons, and
Yeah,
also help you to become a better practitioner in further.
yeah.
So now, when if a person wants to settle down in a metro, what are the kind of job opportunities that you think a person can get in while, and subsequently, what is the kind of lifestyle attached to that opportunity, if you can give?
See, if you are fresh, like you have just done post graduation with few years of experience, it's difficult to get a job in good setups. Like you cannot become an independent consultant. If you want to do that, you have to go to tier 2 or 3 cities.
Mm,
For independent consultant, you need at least 10 years of experience, and you should bring some value into your practice. Like
mm,
what I had was a great patient bank. Like I did not have very good international experience of that
mm,
sort, that I didn't do like 3 years, 5 years fellowships from abroad. I did only
mm,
short fellowships and trainings from abroad. But
mm,
if you bring some value with that, like people, corporate hospitals would always like that if Dr. Verma is coming to our hospital, he should bring us business to us. So there should be at least two things with you. You should have a good experience,
mm,
and you should have a niche in one of the fields like endoscopic spine surgery. You
mm,
should be master of one trade at least, and
mm,
you should have number of patients. If you don't have that, it will take some time. So
mm,
in that case, you should do some freelancing. You should join as a like junior consultant or associate with, and you have to select a mentor or a godfather. Like I always say, you cannot choose your father, but always you can choose your father-in-law or a godfather.
yes.
So
Mm,
choosing a mentor is very important. You should be very integrity should be good. Like if you attach with some senior, you should be faithful, you should be ethical, you should not be like always thinking about yourself. You should be part of a great team. You should choose your mentor and stick with that. Like if you stay with a setup for a few years, definitely you will progress upward.
yes,
So
yes, yes.
always should feel gratitude towards your mentors who teach you and who make you learn new things and make you progress into the life. Yeah.
Definitely, definitely. And I, you
So
know,
it's a challenging, little bit challenging in metro
yes,
cities to settle down
yes,
for a
yes.
newcomer. Yeah.
Yes, definitely. And actually, medicine, luckily with medicine as a field, we learn so much from our seniors and from our mentors, that because seeing them doing things and being guided by them since they start, from our seniors to our with during our practices, they are the people who guide us well and who take us to the level that we want us to know and
Yeah,
we
it's
want to.
a double-edged sword, I would say, that sometimes we learn so many bad things also from our early days.
Yeah.
It becomes extremely difficult to unlearn those things. So
Mm-hmm.
initially, I would suggest that everyone should visit 2 or 3 places at least. Like you should
Okay.
not get stuck to one of the techniques or one of the things which your seniors have told, or your parent medical institution has told you. So if you visit
Mm-hmm.
different places, then you can select that yes, these are the people who fits into my wavelength, and these are the guys who like
Mm-hmm.
resonate with my kind of practice. And then you should start unlearning new things also. Unlearning is also very important. So it's a
Yes.
continuous like process.
In fact, unlearning is difficult also. In
It is a
whatever.
very difficult, yeah. It's very
Yes. Yes.
difficult, yeah.
Yes. So now, when you mention different kind of, you know, different kind of job opportunities, what is the kind of lifestyle in a metro? It's very different than a tier two, tier three town. How how you have worked as a freelancer also, and now you are a senior consultant in a corporate. So how has your lifestyle changed?
Yeah, all the challenges of freelancers, like you don't have time for yourself, you don't have time for your family, and you are always on the go. Like after a certain period, you become tired of these things. So corporate hospitals have better lifestyle, but again, there are challenges there also. But I would suggest you should be in a good team, and you should be willing to share the money. You should be willing to share the experience, and you should have always attitude to teach others. Like if you focus always on money now, you are not going to be successful.
Hmm.
Like life is very sweet, like it's sweet as honey,
Hmm.
but that is only possible if you don't always focus on the money. Like
Hmm.
there are two types of people who always think about money.
Hmm.
One is who are extremely poor. They will like obviously they have
Obviously.
to think about money.
Obviously.
They cannot live without.
Hmm.
They are extremely unhappy.
Hmm.
Then there is second class who keeps thinking about money. Those are extremely rich.
Hmm.
Then they have a tension about money, how I am going to manage it, what's going to happen with my investment.
Yes. Yes.
So
Yes.
like you should not be into these two top categories.
Hmm.
Once you are well established, then you can become wealthy. But if you
Hmm.
try to become wealthy and focus only on wealth, and you are not well established, then you will not remain happy. So make yourself well established, then you will become happy and wealthy also.
Mm,
So you have to like change your mindset. If you keep thinking about money always, now then it becomes difficult. You should be willing to share, make a great team, raise your colleagues along with yourself. Then work share is there. You can enjoy your holidays, you can enjoy your conferences, meetings, you can learn new skills. So
mm,
making a team is very important. I have a strong belief that if you are working in a good team,
mm.
then your life is sorted and it becomes extremely smooth.
Yes, yes, definitely. That's and
And that
that's
culture is was not there in North India. It was very popular in Ahmedabad, Gujarat, and Bombay.
mm,
But
mm.
now I think it's picking up
It's
in North India.
coming here also. Yes,
Yeah,
yes.
yeah.
Actually, that
Lifestyle becomes extremely.
yes, yes.
It
That
becomes much easier if you are in a team. Yeah.
true, true, definitely. So now, when things are changing, things are evolving. There is a strong need of digital presence as well. So, and especially after Corona coming up, it has become a strong need for the doctors to also have their digital presence and connect with their patients digitally. So something that you can also give an insight, because I know you work on your digital presence really well. So how will you, how, what, some insights that you think about this?
Like as I told you, when I visited USA around 10, 11 years ago, my friend was there in New York, and he was always seeing how many likes are there, how many Facebook things are there. I was surprised, man. These things don't happen in India. We sit at one place and people come. They don't have these things. So, like I was surprised at that time. What are they doing? I have 4-star rating, 5-star rating, 3-star rating. But these are extremely important. You should be uh, social media savvy. You should be tech savvy. You should be very, very informed, and from the day one of your practice you should start focusing on these things. This is going to be a wonderful thing in future, and it has already become, like corona thing have always made a great change, and this has
Mm,
become a blessing in disguise for me
mm,
to learn new skills, to make presentations, to consult online. So I think hard times bring great opportunities, and I think this is very, very important. You should be on Insta, you should be on YouTube, Facebook. And to be true, YouTube is a great platform. I have done many surgeries just watching YouTube. Like my non-medical people who they must be hearing this, they will be surprised that
mm,
how can a doctor see on a YouTube and do the surgeries. But YouTube is a great platform. You can learn so many new things, and then it becomes our responsibilities also to post on YouTube. If you post on YouTube, then your other colleagues can learn from those things. So, and
mm,
again, I will say I always believe that teaching is a extremely important source of learning. If you
mm,
start teaching others, sharing your experiences on media
mm,
platform, then you can grow your practice also. So
mm,
I think this is very, very important. And not only medical practice, you should try to learn new skills. Don't ever make medical profession your sole earning thing. If you keep focusing on medical practice, then you are always focused on the money. If you can sort out the money thing by doing some other business, may it be share market trading, may it be some real estate, may it be some other businesses, you can
mm,
start. Like, do not close your horizons. Then
mm,
you will not focus only on the money. You should
mm,
be focusing more on the patient welfare,
mm,
their aware, teaching them, handholding them, bringing their life up. Like if you try to make people happy
mm,
and healthy,
mm,
money will always come in your hand. And
mm,
if you're focused always on money, then it becomes difficult. So
mm,
try to learn new skills also. That's my advice to all my medical doctors, medical friends,
mm.
because they think we are doctors, we cannot do anything. But I can assure you, you are very intelligent class. You can do whatever you like, and there's always a big opportunities in this era.
Definitely, definitely. I also completely agree with what you are saying.
What you are doing is extremely important. That like you are a medical doctor, but you, again, like along with your practice, you are dedicating yourself to this cause. This is a wonderful cause.
Thank
Yeah,
you so much, sir. So it's just it just comes out of yourself. It just has
yeah,
come out of my passion.
yeah.
So now when it comes to you spoke about patient welfare and patient management also. things are very different when it comes to managing patient in a metro as well as, in your own practice in a tier 2 town. What difference that have you know learned and experienced in this, and if you
Yeah,
can give
metro
a brief
practice.
insight.
I'll say it's not about metro practice. They should be a part of your ethical training also. Like you should not feel like a god. You should like if all the patients are treating you as a businessman, you should also treat them as a customer. And every customer who is paying in private practice needs some attention. When patient enters into your room, you should stand, you should welcome. These are soft skills you have to learn. You cannot be as a god or a doctor like in all times डॉक्टर साहब बैठे हैं बाहर लाइन लगी हुई है वेट करवा रहे हैं ऐसा नहीं चलेगा you have to improve your skills soft skills have to be improved bedside manners have to be improved like you cannot say any rude things to your patient everyone is recording nowadays there are medical legal issues so these are few small things which should be taught to us which we learn from other sources and in this thing international visitations also help there they are so courteous they have to stand they have to say thank you sorry every time so these are few things which I would suggest we should learn and we should not ask our patients rude say anything rudely because they might be recording and this is not part of our culture you should say thank you sorry whatever like soft skills you have to learn you should do that and you should not feel ashamed of those things
Yes, yes, yes,
and
definitely.
people are like always coming with google things in their mind you should have to update yourself there is no harm to see diseases in the google how people perceive them then you will be able to answer them properly you have to like if you are suffering from headache you can search headache in extreme tremendous like wherever sources are available but as a doctor you know the diagnosis that you are having only migraine but he will ask so many questions so you should be able to answer those things
Mm,
and I always believe that patient counseling is very important you should share all the knowledge to the patient you should try to alleviate the fears anxieties in the patient because I see plenty of problems which are happening because of google and all those things so you should like properly counsel your patients and teach them the anatomy physiology how the things are working how the disease is happening in you why you are having these symptoms so more you will teach your patient more you will give insights into his or her problems then they will understand in a better way
mm,
and my CEO of Narayana, Dr. Devi Shetty, he always say that power of healing hands is greater than prayers by the lips. So, like you should also always touch your patients, counsel them. You should be very compassionate towards them, and you should be really into the welfare of patient. You should try to heal them in the first visit. And I strongly believe that whosoever comes in your contact, may it be your friend, colleague, patient, he should feel better when he leave your chamber. He should feel something has happened to him or her that I am feeling better. Because when patient come, they are always sick. They are always परेशान हैं. तकलीफ इतनी है सभी को. वो थोड़ा सा भी better feel करके जाएं, then you should feel successful in your day. And you should give everything what you have in that particular day or moment. Yeah.
yes, 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 yes. Actually, I believe with practitioners, being patient is something that has increased on our part. You need to be calm and patient because nowadays the patients that who come to you are more apprehensive, more, more Google searched, and so this has added a bit of more responsibility on our shoulders to guide them in the right track. Previously the patients didn't know anything and it was just us to guide them in the track, and that was the only road they knew. Now they already know 10 roads and we need to tell them the one. And
Yeah,
actually,
that time had changed actually. There is no,
yes, yes,
the
yes,
time had totally changed.
yes, definitely. And actually that this is very important.
Yeah.
So now, discussing on the last part, what I already have discussed, a lot of simple principles that you have followed in your practice. Is there anything else that we can extract from your experience? That is there anything else that's missing out on the last note?
See, principles will never change. Whatever time may change, principles remain same. First, try to be happy yourself. Unless you become happy yourself, you will not going to make anyone happy. And happiness is a great thing. You have to remain happy, whether you you should be passionate about your work. You cannot become a good medical professional if you're not passionate about your work. Like you should be really excited when you wake up in the morning. Yes, I am going to do these things today. And when you enter into your hospital, your chamber, you should be well dressed,
Mm.
pleasant, always smiling,
Mm.
and never say bad things to your colleagues, because one bad word to your juniors, to your nurses, to your OT technicians can ruin their day. And that again is going to make your life worse.
Mm.
And don't ever judge your patient. Like I used to do that kind of thing. यार ये वाला patient आ गया है, ये तो irritate करेगा मेरे को आगे. ऐसा नहीं सोचना है, क्योंकि आपने वो feeling अपने मन में ले लिया है ना, then it is going to spoil your whole day. So even if someone comes into a chamber whom you think he is always complaining, then also you should make yourself well composed, try to make him happy, and that should be your the day's victory. So
Mm.
whosoever comes to you, whether it's your colleague, your junior, senior, you should make his or her day better for that moment.
Mm.
So these are the few basic things which you should keep in mind. Yeah.
Definitely, this is another way. A really amazing message that you have just shared, which is very important, very very important.
Someone asked me a few years ago, Dr. Verma, you have achieved so much, and what's your purpose of life?
Hmm.
Like I was flummoxed, like I didn't know what to say.
Hmm.
So then he told me three things: that your purpose of life should be to learn new things,
Hmm.
number one, and to use that learning to make others' life better, like in
Hmm.
our case, patients.
Hmm.
And third thing he told me, very important, that whatever you have learned, you should add few more things into that and distribute it. So if you follow these three things, always learn, always use your learning to heal others and propagate that learning. So these three things totally have changed me, and I have become better person, better doctor, and my practice has also grown.
Hmm.
So I think these three things, if everyone follows, whether he's a medical professional or not, these things are going to make everyone's life better, and our society as a whole will become a better place to live in.
Definitely, definitely.
Yeah.
I completely agree. These 3 points can make your life, successful, and you are a
Yeah.
happy person.
Thank
So,
you.
anything, let's end this on a high note. Any motivational quote from your end for the students who are freshly passed out or are, on the journey of studies? Something on from your end to motivate them.
Like I told you earlier, also, you should try to remain happy, passionate, and try to should have a serving attitude to the society. Like try to establish yourself first. You should become well established first, then try to become wealthy. If you think other way around, then things will be messed up. Yeah.
Thank you so much, Doctor. All of the points that you have mentioned in such a small time, these are such golden rules that if somebody follows can make them a successful medical practitioner and as well as a successful and a happy human being in general.
Yeah, that's very important.
Yes, yes, yes. So actually, these are some really golden points that I'm sure that all of you who are listening are motivated and will give you a right track to follow to establish yourself as a medical professional. Please do share this with your friends and colleagues to help them also understand about these golden points to make them successful practitioners and to guide them in the right track, because this is very very important as a medical professional with so much of stress of studies and everything. There are times that we forget about these, but people like Dr. Rajesh who come and guide us on the right track is something that we always need in our in our surroundings. And once you listen to them, they get in your mind and you do better in your career and in your life ahead. So do share this with your friends and colleagues, and to make them a better person and a better medical practitioners. And also, if you are a mentor in yourself, or anybody around you who has mentored you, who has been your godfather, do share them, do share them with us, do message us about them. We will love to feature them on the platform so that we can bring more and better practitioners on the platform to guide all the medical students on the right track and in a right way. Do follow us on our YouTube and Instagram channels as well. We have all our old videos there, which can also guide you in a right way on the right on the in all the phases of your career, in whatever way you are looking for guidance, or if you have any other doubts, do share that with us. We will come with solutions on those as well. Thank you so much, doctor, on taking out time on this on Sunday morning for us to share all your important learnings with us. Thank you so much.
Thank you. It's a great pleasure. Thank you very much. God bless you. Have a great, successful
Yes,
career
thank you
ahead,
so
all
much.
my friends.
Thank you.
Thank
Okay.
you.
Yep. Bye bye. Bye bye, everyone.
Thank you. Bye.